ensure that there's no rubbing or chafing, and they do bleed, okay? Your tough skin will go on next, okay? And this is our starting position. Stop.
Just look at his face. Slideshow again.
It was not
for sure.
Okay, well, concentrate, folks. Your procedure asks you now to do a series of anchors. So the first series of anchors are 2 3-inch anchors that go directly across the nipple line and then just above that. For the ladies, you are going to do one piece that's going to anchor the sports bra to the skin and then go up from that. And we're going to talk about the modifications for women. So that's what your lab is telling you to do. I'm going to use PowerFlex in lieu of those anchors. The lab also tells you that you're going to anchor on the arm. We're also going to do that as well. But again, I'm going to modify it with the PowerFlex. So what I want you to do is just take it up here a little bit. So then the lab would have asked you to do 3 strips here. I am not putting any tension on this because these are just underlayment, and then I will do my elastic tape on top. This is a modification that I've just added to the lab really just to save your skin. You'll thank me after.
So normally we don't do it?
Otherwise, it's done directly on the skin.
With the zinc tape?
Elastic.
Oh, elastic.
Yeah, it's just to save the skin. So normally this is where the elastic would go. But rather than ripping elastic off.
Okay, so here we go now. This is just the underlayment. I should have actually have put my donut pad underneath there, but I'm going to palpate my clavicle.
So we don't normally do this then? Or we all...
I'm going to ask you to use this.
Yeah?
I'm going to ask you to do this, yeah, because there's for multiple reasons, 3 reasons. The elastic tape doesn't tend to stick very well, and it's futzy. It's already a very convoluted procedure to begin with. This is just going to ensure you success. Also, again, it allows the athlete to be a little more comfortable with the tape on. Tons and tons of us are allergic to the elastic to begin with, so that's another reason. Okay. So my donut pad went in, and remember I would have done my tough skin on top of this. Okay, so first thing I'm going to ask you, so key elements here, folks, is we're going to pull the acromion up, and we're going to push the clavicle down. Okay. So from our stable base, we're going to go around one big muscle here. There we go.
She said big.
I'm trying.
1 or 2, whatever is appropriate in this case. I'm just going to do one. What I'd like you to do now, just relax. Relax. There we go. Turn your face that way. We're going to do 3 pieces of elastic tape and making sure that we've measured appropriately. Straight down on the clavicle. We're going to land just off of our anchor because we're going to fold that back in a second. So these steps are to push the clavicle down, yeah?
Yeah.
Yep.
Yeah.
Yeah.
They sound good.
Yeah.
Yeah.
It's usually
kind of fanning those then off?
Yep. Yep. So I did one straight down, I did one this way and one this way. Okay, so we've made a cross, X over top of our donut pad. We're now down on the clavicle. Now we're ready to position the arm to do the acromion. And this is going to require a very wonderful herringbone. Can I have one of those chairs you folks are sitting in? So what you're going to do is you're going to sit in the chair with your arm on the bed. Now, the patient position here is roughly 30 degrees of horizontal cross flexion and about 70 degrees of abduction. Okay? So do what you have to do to get the athlete in that position. So there's my 30 of cross flexion. This is my abduction that I want. I'm going to ask you to use the both beds to go up and down. I'm going to move that for you. But I'm going to do this. Okay, Roger. Okay, so here we go. Here's where we're going to take the, what happened to my zig? Okay, thank you. This is where we're going to do our herringbone, and I'm going to concentrate on bringing my X's straight up to that pressure pad. And I'm bringing the humerus up, okay? I'm going to do that by a series of hooks that are going to hook the arm back up. I'm going to landmark roughly with the first pieces. Both these pieces should sort of square off the axilla so that I end up with a nice triangle. So the first piece hooks around the arm on the anchor, squares off the axilla, and lands on the posterior anchors. I'll spin them around to show you. This next one squares off the axilla here. These are my starting points. You with me?
Kinda.
Okay, so I've squared off the axilla here, I've squared off the axilla here, I've hooked on the arm, and I'm bringing it up. Now I just keep going with my herringbone. You guys are herringbone experts?
All of you. Are you starting just on the side of them? Or do you want
I'm just hooking around the arm. And watch what happens when I get to
You're not videotaping or anything, Bo.
off the anchor.
You guys want me to see anything?
Go away. I'll spin them around in a sec. Sorry, I didn't mean
No.
to.
I'm used to it.
You go to bars. You go to bars, right? So
All told me the same thing. We're mad.
Okay, so here's where what's going to happen. I'm going to lose my anchor, okay? So now what I'm going to do is I'm actually going to wrap this piece of tape underneath here and keep going.
so intense.
Yeah.
This is intense.
It's a fun tape job. Wait till you see this beautiful herringbone.
How much pressure are you applying on the zinc as you're going around?
Pardon?
How much pressure are you applying on the zinc as you're going around?
I'm just being snug with it.
15
I
minutes.
think when he's finished, when I'm finished, Jamal will give you a sense that his arm is being pulled up simply just by the tape.
Okay.
And I'm going to test for function, so I don't hit you in the face, okay?
He's supposed to feel like his arm is being pulled up.
So when I tested for function, so I'm done. But and so come and see this herringbone, folks. I meandered. It's not as effective as it could be. Okay. So I meandered a little bit, but that was where I was going. Okay. So back away.
Go away.
Go away.
I know what it feels like.
Can he turn backwards?
Stand up.
Slippery over there.
So last step is for me to do one more anchor here to hold the herringbone down, one more anchor here, and roll everything up. Here's the second modification of the day. You'll thank me after. You can ask your older students if they will appreciate this. You ready?
I have to figure out to post this so you guys can all get it.
We should make it a Facebook group for stuff.
You can just point that finger
We
out.
want to make one for volleyball,
Ooh, that'd be good.
so that we know we're in volleyball. But when we're playing a first year team.
Oh, fuck 'em.
Yeah, I was told yesterday, so whatever.
Goodness gracious.
Lord.
So we get 15, 20 minutes to do this one, the exam.
Yeah.
Trust me, it can be done.
Half an hour tomorrow.
I'm out of power flex, I do one more, and then I'd be done. But I'm out of power flex, so just imagine that last one there. So here's my test. He needs to be able to abduct to 90. He can do perfect, 90 is good. Relax. I want him to try to horizontally cross flex. It should be limited by a couple of degrees. Let's see the other side.
Oh yeah.
Okay, so it's limited by a couple of degrees, and I want him to extend, show me what normal is. Okay, and on this side it should be limited by,
Totally. Cheating.
he's cheating a little bit. Can you breathe? Can you breathe? Is it too tight?
No.
Too wide? There you go. Let's try it.
This is.
See your therapist first, maybe like they're reducing the same.
So, keep in mind, folks, we would only do this for maybe the first or second week back, and then we would modify it to the next procedure, which we're going to do. So far we've done the swap, Brad spanking acute, rehabbed it, ready back to sport. We do this one, and then we're going to do yet another one. So let's try this one.
He
Off you go.
busted through it.
Patch this up.
Can
Can you patch this up? I'm too jacked also, I'm sorry.
Show me.
That one.
Oh, I sure we could cover that.
It was closed. He busted
was
through
closed.
it.
Busted.